Joining me now is Dr. Gerald Fitzgerald. We call him Joe. Thanks so much for joining us today.
Dr. Schuck, good to see you again, my friend.
Yeah, now we're going to talk about something that's cutting edge, something that's new, something that's a little different that a lot of people have a lot of problems with. It's that interesting problem we have underneath our chins or maybe a little bit too extra stuff on the sides. It's called CoolSculpting. So first let's talk about the science. How did this come about?
CoolSculpting was invented by two Harvard physicians. They were trying to use heat previously to destroy fat. These are the two doctors that did Fraxel, IPL, and lasers. And they tried heat to destroy fat in difficult areas. What happened was they found out that heating too much would cause dimples and scarring and difficulties with that. So they went back to the drawing board. As any good scientist, they read the journals and they found out these children in some of these other countries were teething and they had a popsicle. They held it too long in one spot. That caused a dimple in one of their cheeks. Now luckily you're born with a certain number of fat cells. After adolescence, that number never changes. So these kids wouldn't get scarred when they quit teething, that fat would come back. However, after adolescence, that wouldn't happen. That's what gave them the correlation between cold, freezing the fat, permanent spot reduction without cutting.
So we talk about safety issues because obviously we know that if we cook something, it doesn't matter. But if we cool something, they found out that the fat cells in the regular tissue were different. Tell us about that.
That's excellent. The fat cells freeze at a higher temperature than muscle, endothelial, blood vessels, anything else. So fat can be destroyed easier with a little warmer temperature, even though you're freezing it. So let me try to repeat that. We can freeze the fat. If you can squeeze it, we can freeze it. The surrounding tissue will be left alone because the fat is a big fat globule, a big fat cell. The triglyceride, the fat inside that cell, freezes quicker at a lower temperature or higher temperature than the surrounding tissue. So no other tissue is damaged.
Sure. Now, is this a permanent issue or is this like a blunting and then it comes right back?
That's a great question. It is a permanent spot reduction of fat in an area that you don't like, never to come back in that area.
All right. So if we're looking at timelines, so we always want to know, I want it today, I want it done today, and I want it to look better tomorrow. Tell us the procedure as far as timelines and how long it takes for the recovery.
That's a great question because, if people do liposuction or they get a tummy tuck, they kind of get some immediate results, but there's a lot of downtime, a lot of surgery, a lot of cutting, a lot of drains. This takes 1 hour. 1 hour to do 45 minutes for your neck, 45 minutes for the love handles, the bra fat, the tummy, 1 hour. Then start noticing results after 3 weeks. You notice really good results after 3 weeks. It takes 3 months for the macrophages, your normal garbage man, Pac-Man cells in the body, to clear all that fat out to the liver to be gotten rid of naturally. So 3 months, you notice the best results post-procedure.
Sure. How about pain?
The only thing that I've ever had a complaint of is some numbness, some transient numbness or neuropathy.
All right. So this sounds great. Let's see some of the things that actually you worked on. So let's look at some examples. This guy looks kind of familiar.
This guy's kind of familiar. And we were given one of the first Cool Minis in our practice, and I couldn't even button my shirt. So if you notice the picture on the left, obviously that's before, and I'm not even finished completing my side on the right side, but you can see the submental fat has already been markedly reduced.
Wow. Okay. So let's look at the next one. Let's see what else we have.
This is a beautiful woman, and you can see the flank fat, and you notice from the left to the right, the company, CoolSculpting, they're not allowed to say shrinkage, but you can see the fat line in that area. What a marked difference on the left versus the right, where if you do liposuction, the skin kind of hangs, and this leaves a much better result.
Wow. And of course, men can have that too?
Yes, and this is a lateral view of the abdomen when you look at the love handles from the left to the right.
All right, and so obviously any place we can squeeze, we can do. So how about the stomach?
The abdomen is a great area. If you can squeeze the fat, we can freeze it in 1 hour and get permanent spot reduction in that area.
Sure, and we notice this all happens. We're equal sexualists anyway, so females as well.
Oh, this is a beautiful abdomen. She was really pretty good before, but notice the marked like swimmer stomach on the right. And again, 1 hour. The beautiful thing about the practice is there's 4 machines, so instead of like one love handle, then another love handle, like 1 hour, 1 hour, 1 hour, we can do 4 areas in 1 hour.
So it's all the same. So
Correct.
who can't have this done? Because obviously this becomes a big issue. Is like, oh, I want to come to this thing, and all of a sudden now I'm excluded from it. So who can't have it
Well,
done?
that's a great question, because I've had 4 heart procedures, and you took care of one of them. Kind of scary. So I'm a heart patient. I've had a cardiac ablation and 4 cardiac caths. Cardiac patients are perfect for this. Diabetics are perfect for this. The people that can have it are anybody with cold-induced urticaria. They should know this since childhood. Even like ice on their hand, they get the welts, or cold agglutinins in their blood. Those are the only people that are not candidates. Of course, we say please get a consultation with your provider before they do the procedure.
But even if they didn't know they had that, this procedure is not going to cause them any physical pain, right, or any problems. It's not long-lasting.
No, it's permanent spot reduction in that area, but no permanent things like the possibility of cutting and sewing and drains and those things. It's really a miraculous procedure.
Sounds like it. Sounds an interesting piece. Now, you guys are the only ones doing this in the Tampa Bay area?
No, there's other CoolSculpting practices that are doing this. My wife is just a premier practice in all the southwest area of the entire Florida, which is why we got asked to be one of their spokespeople for the company.
Excellent. Well, sounds like, or looks like, actually, you look a lot younger than the last time I saw you, so we'll take this as a positive thing. So, obviously, CoolSculpting doesn't hurt. It's permanent. It can be done quickly, and it doesn't have all the long-acting issues of recovery and drains and pains and things along those lines. So, sounds like a lot of people could benefit from this. Thank you so much for joining us today.
Thanks, Dr. Shuck.
No problem.